All right, everyone, welcome back. We're jumping right into a deep dive today on a story that you might have seen flash by in the news cycle.
Yeah, it might not seem like a big deal at first glance, but trust me, this one has some legs.
We're talking about the CDC.
The Centers for Disease Control and Prevention, the big guys in the U.S. for, well, disease control.
Exactly. They've hit the brakes hard on all their collaborations with the WHO, the World Health Organization.
Hmm.
And this has some pretty major implications for, well, global health, keeping everybody safe from outbreaks and stuff.
Right, because this isn't just about, like, scientists not sharing notes anymore.
No, no, not at all. We're talking about a huge impact on how we track and fight things. Like, well, I mean, you've heard of Marburg virus, right?
Oh, yeah, that one's nasty. Highly infectious, causes hemorrhagic fever.
Not good. And
So,
mpox, that was all over the headlines not too long ago.
and we can't forget about the ongoing fight against AIDS. This decision touches all of that, and honestly, it even has implications for your own health and safety.
So let's get into it.
Yeah.
What exactly happened here? What's the source material telling us?
So there's this memo, came straight from John Gengasong. He's a pretty big name at the CDC.
Right, a real leader in the field.
And this memo is basically an order. It's telling all CDC staff to immediately halt any and all collaborations with the WHO. Like, full stop, no meetings, no site visits, no nothing.
Wow, that's pretty drastic, isn't it? I mean, I remember when President Trump announced the U.S. was pulling out of the WHO.
Right, back in 2020.
Yeah. And even then, I thought it was going to be this slow, managed withdrawal.
You'd think so, right? A gradual disentangling of all those projects and partnerships.
But this memo feels like they just slammed on the brakes.
Yeah.
What's the difference really between a slow withdrawal and this sudden stop? Why is everyone making such a big fuss about this?
Think of it like this, okay? You're in the middle of putting together a huge puzzle.
Okay, I can picture that.
You've got a team, you're all working together, pieces are fitting in, and suddenly one person just grabs all their pieces and walks away. No explanation, no warning, nothing.
That would leave a pretty big hole in the puzzle.
Exactly. And that's kind of what's happening here. All these ongoing collaborations, research projects, data sharing, they all just hit a brick wall. It throws everything into chaos, and honestly, it just breeds mistrust.
And we're already seeing the very real consequences of this decision, I guess you could call it.
Right. It's not just theoretical. Our source material mentions specifically how this is impacting investigations into outbreaks. Like, there are Marburg virus outbreaks in Africa right now, and mpox is still a concern in some areas.
Hotfox, yeah. That's the one that kind of took everyone by surprise last year, right?
Yeah, and these investigations, they rely heavily on the CDC and WHO working together, sharing their expertise, pooling resources, getting information out quickly. And now...
That whole system is disrupted.
Exactly. It's like trying to fight a fire with one hand tied behind your back. It's harder to track these viruses, figure out how to contain them, develop treatments.
And that delay, that can mean the difference between a contained outbreak and something much, much worse. I mean, I don't want to be all doom and gloom, but...
No, it's a valid concern. These things can escalate quickly. What starts as a regional outbreak can easily become a global health crisis if we're not careful. And it's not just about what's happening over there, you know?
What do you mean?
There's this quote in our source material from a Dr. Jeffrey Klausner. He's a professor, works a lot with the WHO, and he points out that the U.S., we get a lot out of this collaboration too.
Oh, I see. It's not just a one-way street of us helping them out.
Right. We learn about new testing methods, ways to treat these diseases. We even get early warnings about potential outbreaks. It protects Americans both here at home and when they're traveling abroad.
So it's like this exchange program. We contribute our expertise, and in return, we get vital information that helps keep us safe.
Precisely. And without that, we're flying a little bit blind, which is why this whole communication breakdown is so worrying. And as if all of that wasn't enough, there's another thing happening that's adding fuel to this global health fire.
Okay, lay it on me. What else is going on?
This has to do with PEPFAR.
PEPFAR. That's the President's Emergency Plan for AIDS Relief, right?
That's the one. It's been hugely successful in providing HIV/AIDS medication to people all over the world. I mean, we're talking over 20 million people getting life-saving treatment thanks to this program.
20 million people. That's incredible. It's literally saving lives.
Yeah, they estimate it saved about 25 million lives since it started. But now the funding for PEPFAR is frozen.
Frozen? What does that even mean?
It means the money's not flowing, treatment programs are being disrupted, medications are becoming harder to get.
Our source material, it has this quote from the president of the International AIDS Society, Beatrice Grinstein. And well, she doesn't mince words. She says that stopping the funding basically means stopping the treatment. which could lead to, well, a lot of preventable deaths.
And she's right. These medications, they need to be taken consistently to work. If there are interruptions, it's not just that individual's health that's at risk.
Right, because the virus could become resistant to the medication, making it harder to treat in the future.
Exactly. So it's a really dire situation, and it's all happening because of, well, decisions being made in the world of politics. It's pretty alarming to think about, honestly. Decisions made by politicians thousands of miles away, impacting the lives of people on the other side of the world, people who rely on these programs to survive.
Yeah, I mean, it just feels like we're getting further and further away from a collaborative approach to global health. It's all becoming so,
Right.
what's the word?
Fragmented.
Yeah, fragmented. And what makes it even more frustrating is the lack of transparency around these decisions. I mean, our source material mentions that they tried to get some comment from U.S. officials about all this,
Yeah.
and crickets, no response.
Yeah, it's a lot of unanswered questions. Will the CDC and WHO start working together again? What's the long-term plan for U.S. involvement in global health initiatives? Nobody seems to know, or at least nobody's saying.
And this silence, it just adds to the feeling that I don't know, we're losing our way a bit when it comes to global cooperation.
You hit the nail on the head. And I think this whole situation really underscores how important it is for us as citizens to stay informed about these issues. You know, these decisions have global ripple effects. It's not just some abstract political game.
Yeah, there are real lives at stake.
Exactly. So we need to understand what's happening. We need to talk about it. And we need to advocate for policies that make sense, policies that prioritize global health and cooperation.
This deep dive has really given us a lot to think about. It's left me wondering, what responsibility do we have as individuals? Given what we now know, what can we do to make sure we're supporting responsible global health policies?
That's a great question. And I think it's one that each of us needs to wrestle with because the choices we make, the things we support, they all contribute to the bigger picture.
Yeah.
And the future of global health might just depend on us getting this right.
It's definitely something to ponder. And on that note, we're going to wrap up for today. But as always, keep those brains buzzing, folks. Stay curious, stay informed, and let's all work towards a healthier future together.
Well said. Thanks for having me.
Thanks for joining us. And to all our listeners out there, until next time, stay healthy, stay safe, and keep those critical thinking caps on. See ya.